Hi everyone, myself Saranya from the Department of Cardiopulmonary Perfusion Care Technology from SNS College of Allied Health Sciences, Coimbatore. Here I am discussing a topic about patient monitoring during the cardiac surgery. Case study, an adult female patient of 56 years admitted in an compliance of left breast pain and a mild giddiness for the past week, and further examination has found out that she has a mitral stenosis and pulmonary hypertension. The patient was also under the treatment for the past 1 year. The patient was advised for an elective mitral valve repair, and as a perfusionist, what are the parameters that you should consider while going on bypass? So this is a design thinking framework which explains this case scenario in a simple way. It is empathy, which is a case report what you have seen today, and define. You have to understand the case. What is this? It is a mitral valve repair. So understanding the requirement of surgery is the patient needs an exact placement of all the equipments needed, and also the blood flow has to be calculated. And ideate means what are the anticipated problems or anticipated flow and pressure resistance that you want to monitor and you want to come up to sort out the problem, and you want smooth bypass. Prototype and testing is about monitoring of the patient vitals during CPP, and evolve is an end of the case that is called as better outcome of the patient. So importance of monitoring is to prevent the patient from getting worsened and for the better outcome of the patient. So monitoring is based on two types, which is patient monitoring and the circuit monitoring. We are seeing about the patient monitoring now. So patient variables, it is depend upon the case, depend upon the requirements of the patients. Each patient is differed from their body and from their hemodynamic status. So you want to monitor the BP, you want to monitor the central venous pressure, you want to monitor the pulmonary artery pressure and left ventricular pressure for all the cases. And physiological response is how the patient has been responded based upon their flows. What is the blood supply that you give to the patient according to the pressure, according to the resistance, and how much amount of oxygen is needed for the given flow. Perfusion flows is mainly based upon the patient needs, that is either the patient is diabetic or the patient is hypertensive patient. Depend upon that the pressure flow and will be getting altered. So the flows has been divided into normal perfusion flow, maximum perfusion flow and minimum perfusion flow, that too according to the change in the temperature. If the temperature is normal, you can give a normal flow. If the temperature is below, you can give minimal flow. If the temperature is above, you can give high flows. So these are the flow recommendation that is based upon the cardiac index, that is 1.6 liter per meter square to 2.4 to 2.5 is to be given according to the patient's body weight. How you know that you are giving an effective flows, which is depend upon the pressure. How much pressure you generate in bypass, that is the line pressure and patient systemic pressure as well as the mean arterial pressure. All have a correlation and a strong relationship which will define about the flows. And the perfusion pressure will be affected by so many factors during bypass, that is hypothermia or uneven vasodilation of rewarming and mechanical vessels compression and aortic cannula tip malposition. Because of all these factors, the pressure will be getting altered. So based upon the pressure, you want to maintain a line pressure of 100 plus or minus 10 mmHg during bypass. So central venous pressure, which indicates about the heart pressure, that is CVP, should be 0 for getting a proper drainage of all the deoxygenated blood to the reservoir. PAN pressure and LA pressure will indirectly say about the proper perfusion flow that you have given to the tissues. So it is saying about the functioning of your left ventricle also. Resistance, which is opposite to that of flow, which is opposite to that of pressure. So if the patient is having a systemic vascular resistance, then you have to administer nitroprusside. Cardiac monitoring, for the continuous monitoring of ECG should be done for the patient, and the ECG should be isoelectric. If there is a change in ECG, that has to be corrected during bypass. Transesophageal echocardiography is to visualize the functioning of all the chambers and the valve what you have placed in the patient. It is a mechanical or a biological valve, that functioning can be assessed. Neurological monitoring is also very much important for monitoring the brain activities during surgery. If in case of any traumatic issues like cerebral embolism, cerebral hemorrhage, you have to monitor the neurological monitoring. Temperature monitoring is much more important than others. Why? Because if you reduce the temperature, you want to reduce the perfusion flows, you want to reduce the pressure. So whatever the surgery that can be done with the help of hypothermia. And urine output, because kidney receives about 25% of cardiac output. So kidney is a major organ. So here the good urine output will say the kidney is on good functioning model. So adequacy of perfusion can also be assessed with the help of urine output. You want to monitor the urine output of patient for every 30 minutes. So causes of no urine output, you have to find whether the cannula is kinked or any problem directly in the urinary catheter or a bladder, that has to be assessed, and the corrective action to be taken appropriate to the situation. Coagulation status is a very important thing, that is you want to maintain the anticoagulation effect of the patient by administration of heparin. The heparin administration will be 1 mg per kg, that is a dosage which is equal to 100 units of. And the coagulation status, at the end of the bypass you want to administer protamine, which is very much more important, because protamine will be act as an antidote for heparin. So these are the major things that you have to be monitored. And the cardiac index should be set by 2.4, and the apt area for monitoring the patient temperature should be the nasopharyngeal, and ACT should be monitored during more than 480 seconds, and urine output also should be monitored with the help of every 30 minutes you want to monitor the urine bag, and flow should be according to the parameters. What are the parameters? The parameters of flow, pressure and resistance.